Good morning. It's a great honor to be here presenting to you this morning, and I thank the organizers, Javed and Bob, for putting this conference together. I was thinking, following the excellent presentations that we had yesterday, and one of the subjects was around critical thinking. And I was thinking about the relevance to the environment that I'm in, where we have an enormous resource, but educating the medical students and the young doctors about not wasting the resource. How do we get better efficiency in a system? Is that different? Okay. How do we get better efficiency in a system and we don't end up having 30 or 40% of our diagnostics being inappropriately requested and therefore delaying the access of some patients who need that care? So that was one thing about critical thinking that I was thinking about. So I'd like to introduce myself. My name is Dr. Mike Richmond. I'm Chief Medical Officer. Before I went to Qatar, I was Chief Medical Officer in a large teaching hospital in the UK. And to some extent, I have two experiences which I wanted to reflect on. Moving to Qatar was probably the best thing that I've done in my professional life. An incredibly exciting venture. And I want to share with you my story, or our story, about what is happening in Qatar. Some of you have come from Qatar to this conference, but many of you will have not ever been to that part of the world. And it's, as I say, it's a sovereign state with the land border of Saudi and in the Arabian Gulf. The population has changed dramatically, and that's the first part of my talk, just reflecting on what is happening in the country. The population of Venice, I checked out, was about 250,000. Year on year, for the past 5 or 6 years, the population of Qatar has grown almost with one Venice arriving every year. We now have a population reported in February 2016 of just over 2.6 million. So that's up from March 2015, as well as having about 350,000 visitors who are on short contracts over and above that. And this is one of the most significant challenges that we have with this pace of change. There's an immensely ambitious vision in Qatar for where it wants to be in 2030. And I just want to highlight to you with a couple of slides the pace of change. And in the circle there is the Sheraton Hotel, one of the many outstanding hotels that we have in Qatar, in Doha. And that's where we are in 2016. And that's the same hotel in the same environment in 1982, 35 years ago. And you can see there has been a staggering change in the environment. The population is unique. It's truly a mosaic of cultures, with many people having been there for less than 10 years. But it's a multicultural society that we live and work in. So this is a picture of traffic in Doha before the rush hour, which gets considerably worse, I can assure you. And with this wealth that the country has and the rapid growth, it puts quite a strain on the infrastructure. and is very challenging. And rapid economic development has other downfalls. The disease prevalence has changed quite significantly over the past 20 to 30 years. So not only do we have this challenge of the growth of population, but we have quite a significant change in the disease burden that we are now having to tackle. The traditional values of Qatar and an affluent lifestyle have evolved in harmony, and this is a common sight, the majlis, and encouraging social interaction between the people, and improving bonds, strengthening bonds between friends and family members. But one of the lifestyle changes that I want to focus on, and this is not unique to Qatar, but it is something that is exploding in this region, and it's moving away from the sort of traditional diet of vegetables, small amounts of protein, dates, yogurt, etc. Sorry. Trying to go back one. There we are. To a diet rich in calories, processed foods and diets, the diet rich in fat, sugar and salt. This is particularly in the younger population. Now, internationally, with the transition to urbanization and affluence, the prevalence of certain diseases, it increases dramatically, moving away from infectious diseases to chronic ill health. Now, the reason that this is pointing this out is that the pace of shift is dramatically different in the Middle East to other societies. The UK and US transitioned over many generations, but in the Middle East, this transition has occurred in just 2 generations. And this is a reflection on the disease instant growth per annum. And as you can see, significant increase in particularly around cardiovascular, metabolic, stroke disease. We have a high incidence of trauma due to the extremely busy roads and a large amount of construction going on in the country. I'm just showing you this linear growth of diabetes, going from 6 that is anticipated it may be as high as 30% by 2025. And this has essentially grown in just over 1 generation. In the West, we describe the silver tsunami, the pressures of an aging population. Qatar has some truly unique challenges. The sustainability of Qatar is somewhat threatened by this chronic disease burden rather than advancing age. So, moving on to the real core of the subject that I have been asked to talk about. Obviously, with the growth in population, the infrastructure required, whether it's around airports, whether it's around road and rail, whether it's around accommodation, but most significantly, it's around the provision of healthcare. And of course, healthcare is an integrated system requiring primary care, community care, but also the development of more hospital beds. This is a picture of Hamad bin Khalifa Medical City, and these are 3 towers of our new hospital opening, hopefully in the next 6 months or so. And these are going to be a tremendous boon to the system that I work in. But buildings alone are not going to be the answer. To some extent, healthcare is around the people that deliver the healthcare. And we're very, very aware of the need to recruit and to develop the workforce that the country is so dependent on. But healthcare is not health. And healthy lifestyles are something that the population is working hard to develop. It looks very different to many parts of the world, and the environment that we live in the Middle East is not conducive to exercise. Sometimes the summer temperatures for those that live there will agree it is stiflingly hot and often very humid, with temperatures sometimes reaching 120 degrees Fahrenheit. I still try to play golf every week. Golf in the summer months is extremely challenging. You lose about a litre of fluid every hour. So keen golfers, they have to be very persistent. My handicap is not getting better. So the country has an extraordinary vision and a true insight to where it must focus, a visionary leadership and an impressive resolve to deliver on its long-term strategy as set out in the Qatar National Vision 2030. Delivering on its healthcare strategy is implicit in this overall picture about delivering a comprehensive world-class healthcare system, an integrated system, preventive healthcare, skilled workforce, etc., and high-quality research. An integrated system is absolutely vital. So, a little bit to the main provider, and this is Hamad Medical Corporation. It's the main healthcare provider of secondary and tertiary care, but also much of primary care. Primary care is in its infancy and is growing, but is not growing at the same speed as secondary and tertiary care. We're an 8-hospital system as well as an ambulance service, and we provide 90% of the acute healthcare in Qatar. I think one of the figures here that I just want you to touch on is there are 2 main general hospitals are seeing something like 2,000 emergencies every day. Now, maybe some of you would reflect on the systems that you work in. This is a staggering amount of emergency attendances. I'm also the acting chief executive of our women's hospital, and the women's hospital is delivering about 18,000 deliveries a year. So it's an incredibly busy system that we work in. When I say 20,000 deliveries here, that's because some of the other deliveries that are in one of the other hospitals. And we've had a large focus, a significant focus on accreditation, and I want to come on to this in a minute. JCI, looking at our overall performance, and then around IGHPE, which has been something that we wish to share with you. So, what are the healthcare challenges, not only around volume and increasing complexity in chronic diseases? Well, as I said earlier, we have a multicultural population, but we also have a multicultural workforce. And because we have doctors that have trained in all parts of the globe, north, south, east and west, we have often a variable approach to healthcare, and that variability in itself possibly is one of the biggest risks to patient safety. We have a skewed population, particularly of young male involved in the construction industry. Threya mentioned the size of the corporation. We have a limitation of our number of beds. Now that limitation is roughly setting at about 1.2 beds per 1,000 population. In different parts of the world, that bed to patient population is significantly higher. But our environment is different from the point of view that we have largely a younger population. But many challenges is that we've just rolled out our electronic medical record, our Cerner system. We are involved with medical insurance. We're developing an academic health system. And over the horizon, we have an endpoint of the FIFA World Cup in 2022, which in itself is looming faster and faster. So, an academic health system. We partner with, as in Hamad Medical Corporation, with a number of institutions, not least Weill Cornell, Qatar University, the College of the North Atlantic, University of Calgary, and CIDRA. And the academic health system is providing us with a fantastic catalyst for moving our system away from a service focus to a significantly more scholarly focus, and acting, as I say, a catalyst for us to change the way we go about business. And this has had a huge impact on our thinking as regards our workforce development. We have a clear plan about how the workforce should develop, about creating a pipeline of talent to create a sustainable future. But of course, any plan, particularly around workforce development, takes time, and there isn't time to wait. So as we're developing our pipeline, we have to mitigate, and the mitigation is around recruiting globally, and recruiting globally with the caliber of individuals that we need and we want to contribute to this dynamic and vibrant environment that we work in. But creating the pipeline is the way ahead, and in collaboration, obviously, with Weill Cornell in Qatar, and as a medical school, but also the emerging new medical school, the National Medical School of Qatar University. The corporation provides the teaching hospital environment for these undergraduates. We're then, on top of that, focusing on our postgraduate program, on our residence program. We have about 700 residents on our postgraduate program. The 700 residents are in programs that have been accredited in the last 2 or 3 years by IGHPE, and this again has been a tremendous step forward, acting as a magnet for young doctors to come into our system, so we're able to recruit and retain the best of the best. Following on from that, we have about 250 fellows in our fellowship program. So we are moving from integrating the undergraduate and the postgraduate program in a structured way, which in time will provide a homogeneous group of doctors who have an approach to healthcare which is consistent with the environment that we live in. But until that is fully productive, our medical workforce is growing year on year. The corporation employs about 25,000 individuals. It's separate from primary healthcare. The growth of the population, it requires this very rapid development of doctors and nurses. And what I want to do is just share with you how we are moving the system forward and trying to develop this the talent pool. The strategic intention is to grow particularly a consultant body who have gone through structured training, and that structured training, it may be something that one would link to sort of Western qualifications, but it's not uniquely around Western qualifications. It's around having a high benchmark whereby doctors have gone through a training program and have examinations which are of the highest standard, such as some of the Arab boards, which are very much equivalent, as I say, to some of the Western qualifications. So we are talking about recruiting our doctors with what we call preferred qualifications. And this is work in progress, but over the last 2 or 3 years, that's grown from 38 to 52%, and that continues to be the path that we're on. And again, just to give you an idea of the size of the workforce that we're dealing with, the system that we describe, and it's somewhat similar to the British system, but it's got similarities also to other systems. We've got what we call senior consultants who are at a certain point. We've got then consultants sit below them. We have a large specialist or service group of doctors. of which they're about 30% of our workforce, as well as fellows, residents and medical students. Now, this is where this it's like trying to change the wing of the plane while it's in flight, which is quite a challenge, because as we grow our residents and our fellows program into consultancy, inevitably we're not trying to terminate contracts, but we are moving away from the specialist model that we hitherto have been serviced with, and this is going well. And then again, from the teaching hospital perspective, we're encouraging an increasing number of our consultant body to have privileges on appointments with Weill Cornell, and we've got about just under 350 of our consultants who have appointments with Weill Cornell. And again, I think this is evidence of a system that's on the move, because this wasn't the position about 5 years ago. One of the hardest things that we have, though, is we are talking about the movement of medical workforce across the globe. And we are in competition as a country with many countries, and in the area that we live in, we are in competition with Dubai, we're in competition with Abu Dhabi, with Saudi, with Bahrain, to recruit the best of the best. And in some areas we are short of recruitment in some of the high pressure areas like anesthesia and clinical imaging. But things like emergency medicine, we have a large number of staff from the point of view of that's where a significant burden of our activity is. We also have spent a large amount of time, if you like, benchmarking the quality of our doctors in revalidation of all of our consultants. This was an enormous task, and it was in a way very rewarding. We have a pool of knowledge now, a reservoir of knowledge about what the strengths and weaknesses of our consultant body is. And this was around looking at their experience and training. This was looking at the qualifications. This was looking at their quality and clinical outcomes. It was looking at research and education. And we were reassured about the quality of about 98% of our consultant body were revalidated. And this was done in partnership with something called Medical Validation Ireland from the Irish colleges, and has been a tremendous fillip to looking at some of the areas of focus that we need to deliver on. Again, our commitment to education, and again, I think there will be very few organizations in the world who would be able to demonstrate that they've got about 97% of its consultants have had the input into continuing medical education and CPD that we have invested in Hamad Medical Corporation. So to draw this to a close, we have an enormous challenge with the population. We have an enormous challenge because of the changing healthcare needs of this population, moving from particularly around chronic disease, and therefore that long-term burden. So it's understanding the magnitude of the challenge. It's about raising the standards of the doctors that we have recruited. It's about this long-term development of a pipeline of talent, developing a quality and safety strategy, building capability and capacity at all levels, creating a framework that is sustainable. We are significantly a physician-led organization. I think that the final thing, though, is realizing that we need to fuse all things best, East and West. Thank you.